Hi, my name is Sudhir. I finished my master's in pharmacology. I work in the field of toxicology. Today we are going to discuss about morphine agonists and antagonists, opioid analgesics. I will be discussing mostly on chemistry and different structures of opioid analgesics. Meet my friend Harsha.
Hi, my name is Harsha. I finished my pharmacy in pharmacology and I work practically on pharmacology, toxicology and oncology. So today, as we already discussed, we will talk about opioid analgesics and its antagonists, and he would deal on chemistry and I would talk on pharmacology and how the mechanism of action takes place in the different organs in our body, in the different systems like CNS, gastrointestinal tract and different body organs. Opium is derived from a plant source called Papaver somniferum. This is also called as a poppy seed. This is a very famous plant. Mostly it is used as a drug addiction. So this Papaver somniferum, in this the latex is derived. From the latex the opium is derived, and this is mainly used as an analgesic. I will discuss about how it acts in the different organs afterwards. So in analgesics there are two types. One is the NSAIDs and another is the opioids. These are called non-steroidal anti-inflammatory drugs like COX-1 and COX-2 inhibitors like aspirin, paracetamol, diclofenac, aceclofenac. So all these have worked. So all these kind of drugs would come under this category, and these are non-addictive. And these are opioids like morphine, codeine, hydroxycodone. So all these come under these opioids. There are many other drugs, and these drugs are mostly addictive. And these opioids are closely related to endogenous structure, peptides like endorphins, enkephalins, and dynorphins. And these opioids, they act on the receptors called mu receptors, kappa receptors, delta receptors, and sigma receptors. So these four receptors are present in the brain stem and in spinal cord in different regions of the brain. So the analgesia is produced. Analgesia is nothing but relieving of pain. So this analgesic effect would come from these two receptors. When this opioid drug binds to these mu receptor and kappa receptors, analgesic action takes place. So delta receptor is mostly involved in affecting the behavior, and sigma receptors are involved in dysphoria. So this is just a basic idea on what are these receptors and how opioids act on this.
I'll talk about chemistry of morphine. If you see the structure of morphine, it has got two hydroxyl groups, and it has got totally A, B, C, D and E ring. 5 rings are there, wherein this hydroxyl group is phenolic and this is non-phenolic hydroxyl group. Coming to the numbering of these rings, numbers from 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. Till date, morphine is obtained from Papaya somniferum only. There is no well accepted synthetic method to obtain morphine in commercial scale. Either we are getting it raw form from latex of Papaya somniferum, or we are using any precursors of that, and we are modifying structurally, and we are going to synthesize this morphine compound. It was first isolated by Setuner, where it was extracted from latex of poppy plant, and it was being used in early ages only for relieving labor pain and all. It is mainly used for relieving deep-seated pain, neuropathic pain. And coming to chemistry of this, it has got two hydroxyl groups and one 6-member hydrogen ring which is attached to methyl group. And coming to ADMA characters of this, it is absorbed orally, and it has got high, it can pass through intestinal membrane easily, and it gets absorbed orally. And metabolites, mainly metabolites are this O dealkylation is one of the main process where it gets metabolized, where alkyl group gets removed from the oxygen, and glucuronide conjugation is the other process where it gets excreted in the urine easily. Several structure modifications has been done to morphine nucleus. This nucleus remains same, and different properties were different compounds were synthesized, which have got many more properties like increased addiction and reduced addiction. Different compounds were synthesized. If you see what are the existing compounds of morphine analogs, we have codeine, where phenolic hydroxyl group is replaced with a methanolic group. This is morphine. I am going to replace this hydrogen with methyl group. This is called codeine. It was synthesized to increase the effect of morphine, but surprisingly, it has got less addictive properties, and it is being used as antitussive agent in cough syrup. It reduces cough. And the other modification which is done is two acetyl groups are being added to this hydroxyl group. This is called diacetylmorphine or diamorphine, or it is called as heroin. It is very addictive drug, and it can cross BBB and show its addiction. It is more potent than morphine. It has been marketed in past as an alternative to acetyl salicylic acid aspirin, but due to its addiction properties, it has been withdrawn from market. Other set of compounds like oxymorphone and oxycodone are synthesized, where this hydroxyl group is replaced with a keto group, and this double bond is reduced. This is oxymorphone. If this hydroxyl group H is replaced with CH3, it is oxycodone. The other structural modification is this 14th 14th position, a hydroxyl group is introduced, and those series of compounds are called hydromorphones. Where a hydroxyl group is introduced here. Morphine with a hydroxyl group and ketone at 6th position. This is a hydromorphone. If I put a methyl group here, it is hydrocodone. There are other class of compounds called 4-phenylpyridines, where this ring is only present. It is also a good potential congener of morphines, where the other remaining rings have been removed, and only 4-phenylpyridine ring is being used as a structural congener. Those class of compounds are the 4-phenylpyridines, and they have remarkable properties like less addictive properties, and they can be used as antidepressive drugs, and some of the compounds like loperamide can be used as antidiarrheal drugs. Its action of morphine. Here you see these red atoms are representing oxygen atoms. This is one hydroxyl group, this is the other one. This is phenolic hydroxyl group, benzene ring with alternating double bonds, and this is aliphatic. So you see, this can be viewed in two planes. This molecule is looking like a T shape. This plane is different from the other. This nitrogen, which is attached to methyl group, can be looked in this plane where it is 6-membered, and here you can see is five-membered ring with a central oxygen atom, and this blue represents nitrogen where it is attached to methyl group. Structural modifications can be done to this, like replace this with OCH3 to give codeine, and you can add a double bond O here, oxycodone, oxymorphine, and you can put a hydroxyl group here to this hydrogen, and it gives the hydromorphone and hydrocodone. And this CH3 group which is attached to this nitrogen can be replaced with allyl groups and the cyclopropyl group, which gives a potent antagonist, which we'll discuss.
So let us discuss also this opioid mechanism of action just briefly. So these opioids act by increasing the levels of CAMP. CAMP is nothing but cyclic adenosine monophosphate. So this is induced by prostaglandins. Prostaglandin induced CAMP. So these opioids act by increasing CAMP, and this can be antagonized by a drug called Naloxone. This is an opioid receptor antagonist. This can be acted in the presence of GTP. So these opioids act on different organs in our body. They have analgesic effect and also have some side effects. So the first one is we shall go to the CNS. In the CNS, it gives analgesia, drowsiness, lethargy, and decrease in the visual activity. This occurs decrease in the physical activity, and also mental clouding. So these lethargy, this visual activity, decrease in visual activity and decrease in physical activity occurs in the intoxication of these opioids. Apart from this, it also induces the convulsions. Convulsions are nothing but it's an rapid electrical activity in the brain, also called as epilepsies. So these convulsions are also produced when the opioids are sometimes heavily intoxicated in the body, and these convulsions can be again antagonized by the use of a drug called Naloxone. And it also produces analgesia. You know, uh, analgesia actually, these opioids are mostly active on dull pain, which has been, if the patient has been having a slight dull pain for a long time, instead of having a sharp intermittent pain. So it is more analgesic in that kind of pain instead of this intermittent sharp pain. This doesn't block the nerve terminals in the neurons. It just decreases the conductance of these neurons in the nerve terminals, and there is a decrease in the substance P. This would lead to analgesia. And let's talk about its action on locus ceruleus. This is a part in our brain which would lead to emotional pain, fright, and panic. So this would be inhibited by alpha agonists and exogenous and endogenous opioids. Exogenous and endogenous. And apart from this, if there is an intoxication of these opioids, there is we can see catalepsy, or circling or stereotypic behavior in rats, and we can this kind of circling and the stereotypic behavior is only seen in rats but not in humans. In humans, muscular rigidity is very common. There is an increase in the prolactin, and there is a decrease in the hormones like gonadotropin releasing hormone and CRF. This is also called as a corticotropin releasing factor. This prolactin increase would by interfering with the inhibition of dopaminergic neurons. And here how it acts is by acting on hypothalamus. We all know that hypothalamus is a place in the brain where it actually regulates the body temperature. Like for example, if we have some fever, so that is the main region actually where this body temperature regulation takes place, and it is also known that COX-3 enzyme is also there, so paracetamol acts in this way. So along with that, hypothalamus would release some of the hormones like gonadotropin releasing hormone CRF, in which they produce FSH, LH, ACTH, and beta endorphin. Follicle stimulating hormone, luteinizing hormone, adrenocorticotropin releasing hormone, and beta endorphin. These were released from the gonadotropin releasing hormone, and these in turn would decrease. If there is a decrease in these hormones, obviously there would be a decrease in the testosterone. Testosterone levels in the body, in the blood plasma, and there is also decrease in the TSH, thyroid stimulating hormone. So this is all about the action in the CNS. Let's talk about another system. It also acts on CVS, cardiovascular system. It would inhibit the baroreceptor reflex. So obviously there is a decrease in the heart rate, and it would decrease the peripheral resistance. So there is a hypotension seen, and especially orthostatic hypotension is very common in people who have taken opioid drugs in excess. In the gastrointestinal tract, let's talk about in the stomach. In the stomach, it would decrease the hydrochloric acid production. And in the first part of the duodenum, in the first part of the small intestine, duodenum, when it starts, there the tone is increased, but the contractions would decrease. The propulsive contractions would decrease. And because the hydrochloric acid is not released from the stomach, the digestion doesn't take place properly, and in the small intestine, it would, because of the lack of propulsive contractions, the food doesn't flow properly, and from the pancreas and this biliary tract also, the juices are not released. The pancreatic juice and bile juice are not released, so that those are also helpful in digestion of these food and particle drugs. So there is a decrease in the absorption of drug, and also there is a decrease in the digestion process in the small intestine. And because the food is stored for the long time in the small intestine, and the water is gradually absorbed into the circulation in the blood, which taken back from the body, and leaving the food particle in the small intestine, thereby increasing the viscosity of chyme. There is a gradual, frequent, intermittent spasms in the small intestine, and in the large intestine also, because there is no peristaltic movement. There is a increase in the water uptake there is a desiccation of feces, and also it would be very difficult for a person to, these feces are really difficult to move through the colon into the rectum. This is in the gastrointestinal tract. In the uterus, there is a prolonged labor when it is used. And let's talk about skin. And here I forgot to mention here, there is also an increase in the histamine level. Histamine also would lead to vasodilatation. So because histamine also increased, here pruritus and urticaria is seen in the skin. In the immune system, the natural killer cells, the macrophages, are present in the immune system, and what is the main role of them actually is that by engulfing the foreign particle, macrophages, they engulf the foreign particle and digest them. So here the immune system is also damaged. When not damaged, it would decrease. There is a decrease in the count of macrophages and the peripheral mononuclear leukocytes. Another one is respiration. Let's see how it affects. It would decrease the rate of respiration when there is an increase in the opioid levels in the body. Morphine is increasing in the body, so there is a decrease in the respiration rate and there is a decrease in the minute volume and also in the tidal exchange. In the biliary tract, there is an increase in the pressure, so that would lead to biliary colic also sometimes. And actually, these opioids are given to the patients who sometimes who are suffering from colic patients, biliary colic. There is an obstruction in the biliary tract. So these opioids are given, and sometimes it is very difficult to treat them with these analgesics like morphine, and that may also even exacerbate the condition, giving the higher pressure on the biliary tract, and that may lead to again more severe to the patient. And pupil meiosis can be seen. Meiosis is nothing but there is a contraction of the pupil size. So this is the main. These are the different actions in the different organ systems in our body. So now we'll discuss. Let's talk about the drugs, the opioid drugs. The first classification is methadone and its congeners. Methadone is a opioid drug, and this is just related to morphine, but it leads to CNS excitation and also it would lead to tremors and seizures. That is due to mainly because, as already my friend discussed on this chemistry and pharmacokinetic profile of this methadone, there is in the pharmacokinetics and in the biotransformation of this methadone, it would lead to normepiridine, which is the active one which would lead to this toxicity. That is why the patient have the seizures and the tremors. Muscle twitches are also seen. And this normepiridine is having a long half-life of 15 to 20 hours. Because it's having this long half-life, patients who are having this renal impairment or hepatic impairment may have this increase in this duration and also would lead to toxicity. The second one is diphenoxylate. And this diphenoxylate, because it is having some unusual property that it doesn't easily dissolve in aqueous solvents also. So that is why it is very difficult to make it in a parenteral solution. So it comes as a solid tablet form or as a suspension or as a liquid form. Loperamide. This is very common drug and this is used mainly as an antidiarrheal. So this opioid drug called loperamide, it would act on the opioid receptors in the brain and also on the gastrointestinal strips. So that whereby it acts by uptake of this water from the lumen of the gut. So thereby acting as an antidiarrheal. And fentanyl is also a compound used as an analgesic. Apart from this, opioids, they act on the CTZ. CTZ is nothing but chemotrypsone. This is present in the brainstem, also called medulla oblongata, and it is present in the area posterior. Area posterior of medulla oblongata. Let's talk about another one, methadone. Methadone and its congeners. This is also very similar to meperidine, but it has some other extra benefit compared to meperidine, that it increases the duration of action, and it also suppresses the withdrawal symptoms. There is another drug called propoxyphene. There is another classification called agonist-antagonist or partial agonists. In this classification, there are drugs in which they act as a agonist of one receptor and they act as antagonist on another receptor. The drugs like pentajocin, these would act as a kappa agonist. They act on this kappa receptor agonist. And nalbuphine drug, these would act as kappa agonist, and this would act as an antagonist at mu receptor. Mu receptor antagonist. And there are other drugs called buprenorphine, butorphanol, meptazinol, digoxin. So these are all the drugs which are actually opioid analgesics. So before going to the antagonists, we shall go to the chemistry of antagonists.
Compound is naltrexone and methyl naltrexone. This is similar to morphine, where here instead of hydroxyl group there is a keto group, and there is no double bond. Here hydroxyl group is present. This methyl group is replaced with cyclopropyl group. As a result of this structural modification, it produces an antagonistic effect when compared to morphine. The other drug of same class is methyl naltrexone. One more methyl group is introduced with this nitrogen, creating a positive charge on this nitrogen. This is methyl naltrexone. The other drug is naloxone. Naloxone is N-allyl oxymorphone. As we discussed in previous lecture, this is oxymorphone. There is hydroxyl group here. And here, instead of methyl group, it is replaced with an allyl group. This is naloxone. It is N-allyl oxymorphone. The other drug is elmifene. Here it is attached to an alkene group, so you can remember like elmifene alkene. Methyl group is replaced with cyclopropyl group. same with that of naltrexone. This completes our morphine antagonist molecules, and they are mainly used in treatment of overdose of morphine, and they produce opposite effect when compared to morphine.
As we have already discussed the chemistry of these antagonists, this naloxone, naltrexone and these drugs are antagonists, and especially this naloxone is a competitive antagonist. Competitive antagonist. It doesn't have any effect when it is given to a normal person who is not intoxicated by opioid drugs. So when a person is got intoxicated with this opioid, this naloxone would competitively bind with the receptor. So by thereby relieving the symptoms of this opioid intoxication, like there is an increase in the respiration rate. Immediately there is an increase in the respiration rate, and also there is an increase in the blood pressure. So this naloxone, naltrexone are the antagonists, and these drugs are also are used in post-operative pains. For example, if a person has gone for a surgery and into the post-operative treatment, these opioid analgesics are given. So when these are given, the person also sometimes he may feel some daydreams, like sometimes hallucinations are also seen in the person. So this naloxone drug can be used to treat those symptoms. And the final one is centrally acting antitussive agents. These are nothing but cough suppressants. We all know that cough is produced because of some foreign particle has gone into our nostrils, and that may trigger the cough. Centrally acting antitussive agents. When any foreign particle has gone into our bronchial nostrils, then our bronchioles get constricted, and that would lead to a cough. So there are many drugs which are used as antitussive agents, like dextromethorphan. This is a very common drug which is used. Along with this dextromethorphan, there is another drug like codeine is there, diphenhydramine, levopropoxyphene, noscapine, hydrocodone. So these are all the drugs which are actually antitussive agents. So this is all about the opioid analgesics, and we have discussed about the chemistry and the pharmacology.
Hope you enjoyed our video. If you like our video, click subscribe and keep updated about all the latest videos in pharmacology and medicinal chemistry. We are thinking to integrate both pharmacology and medicinal chemistry in a single platform, so you will be more clear about the basic concepts of chemical structures, how to remember them, and their mechanism of action in detail. So keep visiting our page. We will be updating with new videos.
And if you have any doubts regarding this subject which I already explained, and if there are any mistakes to be, if any corrections to be made, if you have any kind of questions or any queries, please send me a message into our email ID provided.
You can comment in the comment box provided down.
So we will definitely give reply to this. Thank you very much.